Colin Mason will talk to us about acute bacterial pleuropneumonia in adult cattle, a retrospective study of post-mortem cases.
Thank you very much, Mr. Chairman, for both your introductions. Thank you very much to WBC for the opportunity to speak to you today. And thanks to you for staying the course and staying to listen to me after what I'm sure has been quite a long and informative day, and also a long night last night. So what I want to talk to you about today is a series of cases that we looked at of acute bacterial pneumonia in adult dairy cows, to describe some of the findings that we saw in the post-mortem room, to describe some of the laboratory tests and investigations that we did, and also to share a few thoughts on the risk factors and why we think this disease is of increasing importance. Most veterinary focus of all of us is on pneumonia in young stock. And in recent years, particularly in our area of southwest Scotland, there have been increasing reports to disease surveillance centres by practitioners of acute, severe pneumonia in adult dairy cows. And I think the reason why practitioners are concerned about this is it falls into a problem case category for them in some situations, with a poor response to treatment and sometimes just an acute death. Okay, if we look at the literature into this, there's different reports in the literature highlighting what's going on out there. The first 3 bullet points on the slide there are probably quite subjective data and from biased populations of cattle through surveillance studies, which do suggest that adult cow pneumonia is an issue. If you look at the bottom 2 bullet points, studies that were carried out firstly on one large American dairy farm, and then secondly in an American slaughterhouse over a period of 3 days, does suggest that pneumonia in adult dairy cows is a potential issue. And if we take all of those studies together and all those reports together, it would estimate that somewhere between 2 and 11% of dairy cow deaths on farms may well be due to respiratory disease. If we look at the diagnoses in the UK, this is based again on passive surveillance data from the UK. It pulls out certain common findings of recognized syndromes, be it isolates of T. pyogenes, suggesting a chronic suppurative pneumonia, genuine diagnoses of IBR, and genuine diagnoses of parasitic pneumonia and husk, which are recognized syndromes and discrete really from what I'm talking about in this presentation. So in the UK at least, the term acute bacterial pleuropneumonia was first reported and described by David Harwood to a BCVA meeting in 1995. The reason why he was concerned and others were concerned at that stage about it is the pathology was not dissimilar to contagious bovine pleuropneumonia, which had been eradicated some 100 years before in the UK. He described an acute syndrome with a poor response to treatment, high mortality, and a bacterial type pathology. And what I'm really focusing on is these cases as part of this retrospective study of 26 cases submitted over a 10-year period to our disease surveillance centres. I accept entirely that this is a biased population of cases and there are more of these cases out there. Also, as was reported yesterday in another presentation at this meeting, that there will be milder cases that do live, that do survive and do respond to treatment, and there will be a range of cases out there. Our inclusion criteria for this study is that it would be only acute bovine pleuropneumonia cases. Other specific diagnoses such as IBR or husk were excluded, and a full case history and a herd history was available. Our diagnosis was based on gross pathology, and a series of diagnostic tests were carried out. If we look at the descriptive data of the herds, a lot of this information would probably describe a typical dairy herd in southwest Scotland over the last 5 to 10 years. We had 26 cases from 22 herds. They tended to be from larger dairy herds, and the majority, nearly 60% of these herds, purchased cattle. All herds vaccinated for BVD and IBR, and no herds would have been described as BVD-free at the time of the study. 54% of herds permanently housed cows, and of the remainder, an equal split either housed high yielders all year round or just housed cows during the winter months. Cases were sporadic, although some herds did report repeated cases over years, and there seemed to be no seasonal trend in the appearance of these clinical cases. What we would really love to do is to look in more detail at a case control study to tease out some of these risk factors in more detail, and I will allude to that a little bit more at the end of my presentation. So the typical individual case history of an individual animal, age range was 2 to 10 years old. There was no particular age trend towards younger animals. 50% of cases occurred within 2 months of calving with a sudden onset of respiratory disease. This is a real sudden condition, either significant or complete anorexia, and again, significant or complete milk drop. These cows really did plummet in their milk production, very dramatic. From either the farmer or the veterinary practitioner point of view, these cows were treated with antibiotics and non-steroidal anti-inflammatory drugs with a poor response to treatment, and within the case series, these animals either died within 24 to 48 hours or they were euthanized on welfare grounds. Typical clinical signs: severe pyrexia, tachypnea and dyspnea, very, very poor rumen fill developing very, very quickly. 3 cases had evidence of epistaxis, and halitosis was also noticed in 1 case. Cows seemed to be in significant pain. Was described in terms of an arched back, respiratory grunting, etc. But coughing or nasal discharge did not appear to be a consistent feature. The pathology seen in these cases, in a lot of cases, was quite severe and certainly explained the severity of the clinical signs. We were looking at a fibrinous pleurisy, which was severe, as in this case, sometimes slightly milder. Significant lung consolidation with an antroventral distribution, as one would expect. Emphysema that may have been secondary to the lung consolidation, and there were some secondary or associated findings in a smaller number of cases: abomasal ulceration and metritis, as one might expect in cows in early lactation. Pleurisy, a significant finding, and then the severity of the antroventral lung consolidation, as I said, certainly went along with the severity of the clinical signs. All cases were examined histopathologically, and the diagnosis was one of an acute suppurative bronchopneumonia. In 10 of the cases, there was evidence of some chronic areas of lung damage, a chronic suppurative pneumonia, but there was always evidence of an additional acute suppurative bronchopneumonia, a flare-up of disease. And the feeling was from our histopathologists is that this was consistent with a bacterial etiology. A routine suite of laboratory investigations was carried out, virology, initially by FAT and then latterly by PCR, looking for PO3, IBR, BOHV1, and RSV, bacterial cultures, mycoplasma cultures, and DGGE testing. But we have to bear in mind that on receipt of these animals for post-mortem, all had been treated with antibiotics. Okay, the laboratory testing results. The main key finding, which I think is of real relevance, is we could find no evidence of viral infection, which I think is particularly important when trying to tease these sorts of cases out from other recognized causes, such as IBR. No one particular bacterial isolate predominated. There were a range of isolates, as shown on the slide: M. hemolytica, P. multocida, Mycoplasma bovis in a smaller number of cases. Mixed infections did occur in some cases, so there was no particular tie-in with any particular bacteria. We didn't, as part of this study, serotype any of the Pastorelli isolates, although reports from the literature from other UK looks at this condition would suggest that Mannheimer hemolytica A1 and A6 are the commonly reported serotypes. Okay. This is where we move into less evidence-based and into more discussion with practitioners looking at the risk factors. As I said on an earlier slide, what we'd really like to do is to look at a case control investigation of this disease and this disease syndrome. However, some of these risk factors I think we would all agree would be relevant and have come out through discussions with a lot of the practitioners that submitted cases to us for investigation. So a lot of these would be of no surprise, looking at ventilation, stocking rates, biosecurity, transition cow management, acidosis, etc. Of these, the obvious ones would be looking at general ventilation and stocking rates. But one feature that came out consistently from a range of practitioners was looking at collecting yards, and in particular, how long cows were in collecting yards and the amount of ventilation that was available in those collecting yards, particularly with use of backing gates jamming these cows in. So although there's no hard statistical evidence to back this up, I think looking at collecting yards to consider ventilation in those areas, particularly where the ventilation in the rest of the shed might be good, is particularly important. Another issue that is particular interest is does a predisposing calf pneumonia actually have a significant effect on pneumonia in later life? The age range of animals in this study would suggest that that might not be the case, in that there were older animals as well as first calving heifers involved. But that said, it would seem quite likely to me that you could have an area of damaged lung that may hang around for a long period of time over subsequent lactations, and then for whatever reason there might be a trigger factor that then causes a breakdown of that infection, if you like, and an acute flare-up, which we did see in some cases. Obviously, acidosis and early lactation risks is a potential issue, and certainly we had some evidence within this case series that there was evidence of retained fetal membranes and metritis in these cows beforehand. So the effect that that might have had on early lactation management, predisposing to this condition, is another area to focus on potentially as well. So to conclude my talk, I would suggest from experience in our area certainly that acute bacterial pleuropneumonia is an emerging problem. We cannot identify a viral cause, although we can't rule out other viral pathogens or other pathogens that we've not looked for, an unusual pathogen. We've identified potential risk factors and would accept entirely that further study is required to look at those in more detail. In terms of managing these cases, the key take-home messages from me would be, if you're going to treat them at all, they have to be detected very early. Monitor the response to treatment thoroughly. Go for prompt diagnostics to consider the known conditions that could be manageable, and try and manage the risk factors on each individual farm as best as is possible. I'd like to acknowledge particularly the vets in our area that submitted cases, and for all the helpful discussions that we've had with them over the years in terms of how best to diagnose and manage these conditions. Certainly the help of colleagues within our own veterinary services division, and to acknowledge the funding that we get from the Scottish Government. Thank you very much.
Do we have any questions? Yes.
Hi, Nathan from New Zealand. Just wanted to see, did you check on with, you said about the viral and that sort of stuff, pathology in the upper respiratory tract, and whether or not that was predisposing for any of the pneumonias at all?
Yeah, our standard approach as part of the overall post-mortem is obviously to look at the whole respiratory tract. So we were looking for evidence of either pathology or damage within the nasal cavity and also within the trachea. So the first look will be based on gross pathology, and there was no evidence of significant damage there. We weren't necessarily, what we would be guided on is the gross pathology, but if there was evidence of any problem there, then that will be looked at histologically as well. And there wasn't any evidence of a real significant problem there predisposing to this now.
Thank you.
Okay. Oh, I'm over here. Here, to the right. Aurora Villarreal from the U.S. I'm curious, you said that the farmers reported a sudden decrease in milk production. Did they have daily milk weights to prove that? The reason I'm asking that is because when you have daily milk weights, the way I diagnose pneumonia, and it's really consistent, is a very slow slope in milk production drop of about 20 to 30%. If they drop more than that, it's typically digestive. So a sudden decrease, to me, it's cows that are really chronic already. I mean, they're crashing. And that's what you get to see there, those really bad lungs. Sure. Did they have daily milk weights to say that?
Some of the farms would have done. There would have been a range of farms submitting to this study, but some of the farms, yes, would have had daily milk weights, daily milk volumes, so they would have been able to see quite a sudden decrease. Other farms wouldn't, I accept, and it's a very good point that you make, and it's just going to be based on their perception of the cow, which means that something could have been missed, and what was happening in the 24, 36, 48 hours before that. They may not have had the detailed information on that, but some farms would.
Okay. It's amazing when you see those, there's some I found cows that haven't been diagnosed for 2 months.
Sure, yeah. I think one of the things that struck me sometimes with these is not how they died, it's how on earth they lived, to be honest.
Yeah, exactly.
Hello, John Fagan, Ireland. Just a query. Did you look for Histopathology somni?
Yes, we did. Maybe with time I would have had more detail, but yeah, that was part of the bacteriology that we did, and yes, we did. And that wasn't found in that particular case series to be one of the known causes. Did it surprise you? Not really. Again, this is just purely based on my own experience, but in our area, we would probably see more H. somni in either younger cattle and probably more likely in beef cattle than in dairy cattle. Now, I know that's just based on my own experience, but it's not something that we've commonly diagnosed in adult dairy cattle and probably less so also in dairy calves. And it is something as part of the sort of routine suite of bacteriology that we will look for.
Thank you.
I have one quick question as well. This sounds quite different than the syndrome that Mr. Scott described yesterday, the bronchiectasia with Tuberella. Did you see that syndrome as well and exclude them from this, or do you not see that where you are?
As far as these were concerned, I guess the inclusion in this this particular selection of cases was based on the acute nature of it. So that was our selection criteria. Within that, there was 10 animals that when you looked at it, either on gross pathology or on histopathology, there was evidence of some area of chronic damage, but then what was superimposed on that was this acute bacterial type pathology. So these were not, on the basis of what we could see, these sort of chronic cases that had been going on for a long period of time that Phil described yesterday.
What's one final question? Yes.
Can you rule out lungworms in the hypha population and former pneumonias in the young stock?
Well, in answer to your first question, what I can say is that these cases were not primary husk cases, okay? One cannot completely rule out that there wasn't husk present, lungworm present within these herds, although certainly from the history, quite a lot of these cattle were permanently housed. I accept also that doesn't rule out young stock or dry cows, but we would have ruled out the genuine husk cases from this syndrome and from the cases that I presented. As far as pneumonia in young stock, if I understand your question correctly, this is an area that I would be really interested in, because I don't think we've really nailed this one, is what effect does calf pneumonia then have in terms of predisposing this? And we've started to look at this, and we're just trying to build up the number of cases that we've got. And probably the challenge that we have is trying to link the disease that we see in the cows and getting good enough records from the calves to be able to marry this all up together. And it's very easy to find cases of pneumonia in calves. What's actually more difficult is to find a calf where you can, with confidence, say it didn't have pneumonia to provide you controls. So it's an area that we're really interested in, because I think there might be something more in that.
Thank you.
Okay, before we go to coffee, I'd like to thank you all for being here, and let's thank all of our presenters for this afternoon.